Today, we're asking the question that you guys ask us every single day. Is getting fillers gonna make me look fake? Do you hear this all the time, Smita?
Every single time.
Hello, everyone, and welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I am one of your hosts, Dr. Ashley Amalfi, and I'm joined by my good friend and colleague, Dr. Smita Ramanathan. Hi, Smita.
Hi, Ash. How are you?
I'm so good. Totally new series, you guys. So we're so excited about this. We talked a lot about surgery for the last few episodes, so we are switching gears and we are talking about injectables. And today we're asking the question that you guys ask us every single day. Is getting fillers gonna make me look fake? Do you hear this all the time, Smita?
Every single time. Every single time. I mean, obviously, a lot of our patients, I think both of ours are pretty similar. A lot of them are, virgins, right, when it comes to fillers. And so, they've been thinking about it for a long time. There are certain things that they want to enhance or improve upon, but they're so nervous about looking fake. You
can't blame them. Yeah.
And you can't blame them,
Yeah.
But it comes up all the time. Or if they have gotten fillers in the past and now they want to try a new area or something like that, that is number one, the question that they ask.
It's scary. And I think the reason it's scary is because when you walk around the mall or the supermarket, the only people you notice who have fillers are the ones who look bad, right? What you don't know is how many people have fillers and just look good. And don't look fake or different or overdone. So I understand when you're worried about that because those are the only ones that are obvious to you. But we both have this natural aesthetic, right? So for us, the ideal patient is someone who looks their best and you have no idea that they did anything. They just look great, right?
Yeah, no, I mean, I agree. That's literally what I tell all of my patients. You're only seeing the ones that look fake because they look fake. So they, grab your attention.
So you notice.
But most of the time, I always tell patients, listen, I have fillers in my face, I
have tons of fillers in my face.
They're like, what? What are you talking about? And so, I'm just like, you can get fillers as long as they're done well by someone who is trained appropriately, is an expert at injecting at the anatomy, and they have a natural aesthetic, which we both have. It's really hard to actually make somebody look fake, I think, right? I mean, if you think about the volume of filler and the placement of it, you almost have to aim to put it in the wrong place or just overfill. And you're talking about syringe after syringe after syringe over years or whatever it is. So it's almost harder to make someone look fake than to look natural, I think, in my hands. I don't know.
100%. So if you're not overdoing it, as long as you're not doing these huge quantities and amounts, it's okay to treat multiple areas at once, but we're doing it with a tasteful amount of product and different products in different areas because we want them all to behave differently so that you look nice and natural. So our results, we want you to look great and young and natural, and we certainly don't want you to look different. You want to look like the best version of yourself.
Right. And I also think it's okay, and I often, when I inject, I give them one of those little handheld mirrors that they keep on their lap. And so, I'll treat them. Yeah, and I'm like, here, take a look, or I'll treat a little bit on one side so they can really see one side versus the other.
Yes.
Or with the lips where you can sort of incrementally augment. I'm like, okay, we'll put a little bit in and take a look. We
and
stop whenever you want to stop, right? So it's not like you come in and you just get filled and then you don't see it to the very end and oh gosh,
or you have
there's none of that.
Yeah, or you have no control. We want you to be part of the process. So that's why it's important to make sure you're going to someone who knows what they're doing, who's board certified, and is a core injector or is supervised by one. So that you're getting the most natural results possible, and just have that conversation. Tell people you don't want to look fake. Bring photos of what you looked like when you had a little more volume in your cheeks or under your eyes and things like that, so that you can look like the best version of yourself. We do not want you looking like anyone but you, and we certainly want you to feel and look beautiful, and we definitely don't want anyone noticing at the grocery store that you look anything but good. good.
Do you want to quickly tell everyone what the core injectors are?
Yes.
Just a little reminder. Yeah.
Yes. So when we talk about that, we really are talking about the two main categories of plastic surgery. So that's plastic surgery and facial plastic surgery, as well as dermatology. So those are really the core groups that are focused on aesthetics and will have the amount of training that you want. And oftentimes we'll have nurse injectors or mid-level injectors in the practice, but you want to make sure that they're supervised by one of those core physicians, because if anything happens and you need any help with a complication, you want a core physician who knows how to help you achieve, a conclusion to whatever issue that you're having. Did I miss anyone? Those are what we usually talk about.
No, I think those are the three. That's sort of the key in having safe, beautiful results.
Safe.
Go to someone who is a core, one of the core fields, and have a conversation with them. But this is something that should be fun, right? Like, you should leave feeling your best.
Don't be nervous.
Don't be nervous, because these are all like fun, good things you can do for yourself to feel your most confident.
Awesome. Love it. All right,
Love it.
you guys.
All right.
All right, we're debunking more myths, so stay tuned. This is going to be a great little series.
We'll see you guys next week.
See you soon.